Good afternoon, good evening, good morning. This is Katannya Alven speaking from Canada. Can't get back to England at the moment. I was going to send something to my sister in East Africa, and my niece reminded me, no planes, don't worry. Okay, so there we are. We are in extraordinary times, crazy times, evil times, freeing times. This is the big push of evil being challenged by the light, by good. So I've got up here Trump to drop the hammer on the WHO. On the WHO? Corona's updates from the White House Task Force briefing. Well, before I go into that, let me say thank you very much for all your likes and shares and your comments and your donations. So it's always a joy to communicate with you and receive comments and thanks. So this is very interesting. I want to go to Bombard Body Language, who's done a wonderful one on Dr. Fauci. All these links will be in the description, and please do go on to them, and then you can subscribe. Bombard Body Language does a wonderful job, in my opinion. So here we go.
There's new reporting today that new federal projections suggest I'd like to ask you, if I can, about the new...
All right, let's watch the four sitting in chairs. Two of them are highly suspect, especially in their affiliations with those that the American public deems is not very good.
Federal projections that suggest lifting the 30-day shelter-in-place orders would lead to...
It already starts. This guy starts talking about this leaked document. Fauci brings his hand over. I'm going to scratch myself, and I'm going to look down. Birx brings up her scarf, gets it as close to herself to hide, and she's going to look down. The dominoes begin to fall.
A spike in infections. Have you seen the...
Skips over our Surgeon General, who just stares blankly ahead. It's kind of like the guy who's sitting in the room, and he knows he's surrounded with turds. And he doesn't want to touch anybody, and he's like, I'm not going to look at either one of them. I'm going to stare blankly ahead. The last guy grabs his pocket pen or some kind of scratcher.
Those new projections from your Department of Homeland Security and HHS, first of all.
When did they say this would take place?
They said that it would take place if the 30-day shelter-in-place...
Fauci is still scratching his neck, really stressed. Birx is looking back and forth between the guy at the very end, who's crossed his legs like a girl, and the reporter asking the question, which leads me mentally to believe that she herself believes it was the girl crosser who has put out this document. And because of the way Fauci and her are acting, they are complicit. It's kind of like you may not have leaked it yourself, but the association you have in this conspiracy to leak a document is so close that it makes you very uncomfortable, as if you have done it. We go back. I want to see if Fauci gives an eye over to the leg-crossing girl.
I'd like to ask you, if I can, about the new federal projections that suggest lifting the 30-day shelter-in-place orders would lead to a spike in infections. Have you seen those new projections from your Department of Homeland Security and HHS, first of all?
When did they say this would take place?
They said that it would take place...
Right, I'm just going to go on a little bit and see if I can find the Fauci bit. He comes up. See.
Through this, following along, and you're so willing to jump up. And here he is at the podium, stress in the face, stuttering, stress in the forehead, touching microphones, just because it's the nervous energy is there to take control of something. You don't usually do that unless when you felt like you have no control, you've lost control, or you need to regain control.
But, yeah, that's okay. I still have to...
Great mind body is Mandy, the Bombard Body Language. Absolutely do go onto her website, because there's also an extremely good one of Bill Gates and various other things. She does a fantastic job. Now, this is very interesting. State senator and doctor exposes, whoopsie-daisy, Medicare payouts for COVID-19 patients. This is John Rappaport reporting. Don't look at the people down here. We don't need that. We'll take that ad off. But here he says, my conversation with state senator and doctor who exposes Medicare payouts for COVID-19 patients. As you'll see by the end of this article, the specific decisions about money mentioned here affect life and death outcomes for patients. Now, I'll come back to this in a minute. Here's a YouTube, and bless the man for putting it up. COVID-19 panic merchants, lies, conspiracies, and statistics. Oh, and science. So listen to the beginning of this. He's talking about Fauci.
I'm Sam Vaknin, and I'm the author of Malignant Self-Love, Narcissism Revisited, bringing you the latest from the COVID-19 pandemic. Anthony Fauci is a famous medical celebrity in the United States. He's the czar of the medical response of the United States to the COVID-19 pandemic. Anthony Fauci has published a series of academic papers in which he had calculated the case fatality rate, the virulence, the death rate associated with SARS-CoV-2, with the virus. He calculated this rate to be 0.1%. And then, a day later, 2 days later, after publishing these articles, he appeared on the media, the popular media. And there he said that the case fatality rate, the death rate associated with the virus, is 1%. So among his colleagues in academic papers, he uses the number 0.1% when he appears.
The difference between 0.1
in the popular media, such as, for example, on Comedy Central on March 27th, he uses a number that he knows very well is wrong and exaggerated by a factor of 10.
Exaggerated by a factor of 10 when he's talking to the popular media.
For you to understand, he published an article in the New England Medical Journal on March 26th, where he had calculated the death rate to be 0.1%. And then on March 27th, he appeared on Comedy Central, and he said the death rate is 1%, knowing full well that he is providing inaccurate information, not to use worse terms. Why is Anthony Fauci misleading the public? Why has he been doing it repeatedly for months now?
Why, indeed.
I think the truth is much simpler. The virus is an unknown entity, unknown quantity. No one knows what it is capable or not capable of doing. There's a dearth of data. We'll come to it in a minute. So, both medical professionals and politicians panic, simply panic. They want people to stay indoors because they don't know any better.
We'll go on to this one's titled Questioning Conventional Wisdom in the COVID-19 Crisis with Dr. J. Bhattacharya.
We're recording this on Friday. Quote, if it's true that the coronavirus would kill millions without shelter-in-place orders and quarantines, then the extraordinary measures are surely justified. But there's little evidence to confirm that premise.
There is little evidence to confirm that premise.
Explain that.
Yeah, so I think the key thing to know about the virus and how much we know about it is that we actually don't know how many people have been infected. It's a very strange thing to say, given how much data is floating around. But it sounds like it's a remarkable thing, but it's actually just a plain scientific fact. And that has to do with the fact that the testing for the virus has focused on people who actively have the virus. The tests have been used everywhere. That's what it does. It looks and sees if the RNA of the virus is in you, and if it's in you, then it's positive. If it's not in you, it's negative, and then that's that, right?
If it's in you, you'll test positive, but you might not be actually ill at all. Okay, we'll go on to the next one, or we'll go back to the next one. This is John Rappaport, and I'm going to read this because It opens your eyes. A state senator has suddenly come out of nowhere, made big news. My conversation with Minnesota State Senator Dr. Scott Jensen took place after I read the explosive statement he made to Fox News on April the 9th. So let's start with his earlier Fox statement. It goes, right now, Medicare has determined that if you have COVID-19 admission to a hospital, you will get paid $13,000. Now, he's not meaning the person, he's meaning the hospital. If the COVID-19 patient goes on a ventilator, you will get $39,000, 3 times as much. Nobody can tell me, after 35 years in the world of medicine, that sometimes those kind of things don't have impact on what we do. I reached out to Senator Jensen and obtained clarification. Jensen told me his remark pertained to patients with Medicare coverage, and the 2 payouts he mentioned are standard insurance payments from Medicare, which would go to the hospital. Of course, he explained, some hospitals have a pay-share plan and their staff doctors. Therefore, a windfall for the hospital is passed along to those doctors. Jensen told me, take a Medicare patient diagnosed with simple non-COVID pneumonia, the hospital would receive a one-time Medicare lump sum payout of $4,600. However, if that Medicare patient is diagnosed with COVID-19 pneumonia and Medicare coverage is a one-time payment of $13,000 payment, and if the hospital puts that COVID-19 pneumonia patient on a ventilator, the one-time payment is $39,000. Note, it doesn't matter how long these patients stay in hospital, there is only going to be one lump sum insurance payment. So I infer there are several types of financial incentives for hospitals. 1. Diagnose as many people as possible with COVID-19. 2. Diagnose as many people as possible with COVID-19 who have light symptoms, making it easier to move them out of the hospital quickly. 3. Put as many COVID patients as possible on ventilators for as short a time as possible. Under the heading of diagnose as many patients as possible with COVID-19, there is also the key question of what constitutes a COVID-19 patient and how the use of that label can be multiplied and multiplied. Senator Jensen made a few choice comments for Fox on this subject as well. From Fox News, Dr. Scott Jensen, a Minnesota family physician who is also a Republican state senator, told the Ingram Angle Wednesday that the Centers for Disease Control, or the CDC, and Prevention guidelines for doctors to certify whether a patient has died of corona are ridiculous and could be misleading the public. Host Laura Ingram read Jensen the CDC guidelines, which say in cases where definite diagnosis of COVID cannot be made but is suspected or likely, e.g., the circumstances are compelling with a reasonable degree of certainty, if it is acceptable to report COVID-19 on a death certificate as probable or presumed. In response, Jensen told Ingram, the CDC death certificate manual tells physicians to focus on precision and specificity, but the coronavirus death certificate guidelines runs completely counter to that axiom. The idea that we are going to allow people to massage and sort of game the numbers is a real issue because we are going to undermine the public trust, he said. And right now, as we see the politicians doing things, they aren't necessarily motivated on fact and science. Their trust in politicians is already wearing thin.